Good afternoon. Welcome to Balancing Law, Health, and Economics for Early Learning Programs during COVID-19. My name is Laura Fornash, and I'm a Senior Vice President with McGuireWoods Consulting and co-lead of our education group, but most importantly, a mother of 3 children who were incredibly benefited by caring and loving child care providers and an exceptional early learning center before they went to kindergarten. Before we get started with our webinar today, a couple of thank yous. First, to our esteemed panel. I'm really excited about the program today, and I think you will walk away with a lot of valuable information. Our first speaker is Jamie Colward, Director of State Policy at 0 to 3. Jamie leads the Policy Center's efforts to support states in established, coordinated, comprehensive systems and policies to meet the needs of infants, toddlers, and their families. During today's webinar, she will provide a national perspective on the challenges facing early learning providers, as well as some information about advocacy being done at the federal level. Our second speaker today is Jenna Conway, who most of you in Virginia probably know. Jenna is the Chief School Readiness Officer for the Commonwealth of Virginia, a position that was created especially for her by the Governor and First Lady. Prior to her appointment here in Virginia, Jenna served as the Assistant Superintendent of Early Childhood at the Louisiana Department of Education, where she led a first-of-its-kind effort to unify and improve the state's child care, Head Start, and pre-kindergarten systems since 2012. Today, she will be providing an overview of the current state of early learning and child care in Virginia. And finally, our third speaker will be Brian Barger, a partner with McGuireWoods LLP, who has specialized in labor and employment law for 25 years. We are fortunate to have him with us today to help navigate the complex labor and liability issues facing early learning providers. But before we hear from our panel, a quick thank you to our sponsors who have made today's program possible through their work and passion for early learning in Virginia and the nation. First, I'd like to recognize Lisa Howard, President and CEO of E3, Elevate Early Education, and the new E3 School. To be honest, this webinar was her idea, given the challenges that she is seeing early learning educators are facing. E3, through Lisa's leadership, has been at the forefront in Virginia on building support from both the executive and legislative branches of government for significant policy change in Virginia to advance access, quality, and equity to early learning programs for all kids. My second thank you is to Dr. Javed Siddiqui, President and CEO of the Hunt Institute, who is leading a lot of similar conversations around the nation and helping other states think about how to best serve kids in this challenging environment. If you aren't familiar with the Hunt Institute and their work, please go to their website to see their programs and resources for educators and policymakers. And lastly, thank you to the Virginia Department of Education for their Herculean efforts during this challenging time. And also a thank you to everyone who is participating today for your work in ensuring kids have access to quality education at all ages. Before I turn it over to the speakers, I would just like to provide a few points about logistics for the webinar today. Each presenter will make their prepared remarks, and after the conclusion of all 3 speakers, we will have a Q&A session. And if you look at the bottom of your screen, you'll see a Q&A button that will open a Q&A screen that will allow you to type in a question. And so I will get to those questions at the end of all 3 presenters. And if per chance we run over time, we will make sure that we email the responses to the questions out to everyone so that they'll have the benefit of those answers. In addition, we'll also send out all the slides and the webinar in the next day or so to everyone who is participating. So again, thank you for your time today, and now I'd like to turn it over to Jamie.
Great. Thank you so much. It's so nice to be here with all of you today. As said before, I'm Jamie Colvard. I'm the Director of State Policy here at 0 to 3. For those of you not familiar with us, we're a national nonprofit based in DC, focused on improving outcomes for young children and families. And today I'm just going to open us up with a little bit of laying foundation of the national landscape of childcare and early learning programs, both before COVID-19 and today, and then share some about the advocacy work and the tools we've created in response to the situation. So I know I'm probably speaking to the choir here, but just to start, as I'm sure all of you know, we think it's really important to stress how important it is that everyone understand that childcare and early learning programs really provide critical support for young children's healthy development and learning. We know the first years of life are really critical for early brain development and lay the foundation for everything that comes next. And high quality childcare and early learning opportunities really improve children's early learning, their language development, their social and emotional development, and overall readiness for school. But too often, families' access to quality care is limited because as a country, we have underinvested in this system. Unlike K through 12 education, which is largely funded through public tax dollars, the United States places the majority of the burden for paying for childcare on parents of young children, subsidized by the low wages of early educators who provide that care. And for that reason, childcare providers have long operated on razor-thin margins. Even families with moderate incomes struggle to afford care. This is especially true for infant care, which exceeds the cost of four-year public college in 30 states and the District of Columbia. And similarly, as you know, early educators struggle to make ends meet for themselves and their families, making less than $24,000 a year on average across the country. These challenges really limit access to quality childcare for all families, but especially for the most overburdened and under-resourced families, who are often families of color. The federal government and states do provide some public support for childcare, largely through the Child Care and Development Block Grant, but that funding is far too limited to ensure quality care for everyone who needs it, even before the pandemic that we've entered now. Pre-COVID, only 1 in 6 federally eligible families were receiving help paying for childcare through childcare subsidies. Our national underinvestment in what we think should really be treated as a critical public good forces states to make difficult trade-offs between supporting increased access to care or increasing quality. And our new State of Babies yearbook that I'll show on a later slide explores this by examining some indicators of quality along with several other indicators measuring children and families' health and well-being. Underinvestment also forces providers to make difficult decisions on whether to pay their staff lower wages or charge working families more than they can afford. And it forces families to choose between sending their children to lower quality settings that they can afford or giving up work or income. More than any other factor, this lack of public funding by our country is what has set our childcare system up for failure. And we know that the COVID-19 health and economic crisis has really laid bare the gaps in the existing system. Just briefly, I wanted to share some about states' approaches across the country in response to COVID-19. Approaches have really varied wildly in how states have addressed their child care and early learning systems, much as their approaches overall have varied. But some of the things that we have seen across states are listed here on this slide. Some closed childcare altogether. Some created emergency childcare systems to care for essential workers, which states have defined in different ways. Some left the decision open to providers to decide for themselves. And supports for providers have also varied. Some states have continued to pay providers, either those receiving childcare subsidy based on enrollment instead of attendance, even if they were closed. Some have also provided support to providers that serve private pay families in the form of grants or other supports. Many states have created new health and safety requirements building on the CDC guidelines, including things like smaller group sizes, use of masks, consistent groups. Many of these, are driven by what is required for health and safety, but increased costs for providers. Some set up supply systems to get providers needed PPE and cleaning supplies, offered grants, like I said, either for providing essential or care for essential family or essential workers, or just to assist with being closed with the economic reality right now. And some have also created new sort of technical assistance and training to help providers navigate small business loans and unemployment. And one of the ways that states are doing this is by utilizing some of the $3.5 billion in supplemental funding that the Federal CARES Act provided to the Child Care and Development Block Grant. It was a really important first step in supporting the child care system during this crisis, but more support is really needed to meet the multitude of challenges that I'm sure you can all speak to that you are experiencing. I wanted to call attention, I don't have this on my slide, and you may have already seen it, but there's a new survey from NAUIC that was released earlier this week. They did a survey of child care providers across the country, and the results they found are really just frightening, truthfully, and are in line with what we've seen from surveys earlier in the pandemic. But they found that 86% of respondents were serving fewer children, and on average, enrollment is down by 67%. At the same time, they're finding that 70% of respondents reported that they were incurring additional costs for cleaning supplies, PPE, or changes they were having to make to their facilities. 73% also said that they had or will engage in layoffs, furloughs, or pay cuts. And we know from data that was released before that 335,000 childcare staff lost their jobs just in the first couple months of the pandemic. The most frightening statistic that I saw in that survey was the one that noted that only 18% of childcare programs expect they'll survive longer than a year unless there is additional financial support for the system. And so recognizing that, I wanted to share a bit about 0 to 3 and other national organizations' efforts to really bring this issue to Congress and advocate on behalf of childcare providers and families and the system. So Congress is working to finalize the next round of COVID-19 relief legislation in time for the August recess. And through 0 to 3's Think Babies initiative, we're engaging parents, providers, and other advocates for young children to tell Congress how to sustain childcare. So like I said before, that initial $3.5 billion in supplemental funding was a great first step, but we know it's not enough. And so 0 to 3 and many other national organizations are advocating for at least $50 billion in dedicated childcare funding through CCDBG to ensure essential care today and the industry's survival once the pandemic passes. With this investment, programs can reopen, parents can get back to work, and our economy can fully recover. Additionally, while it may seem tempting to waive childcare regulations in order to cut costs, those regulations we feel are really imperative for the health and safety of children, families, and workers. And so we're urging Congress not to take us backwards by removing regulation that would really leap backwards from hard-fought childcare quality and safety regulations that the field has been pushing for a very long time. Throughout July, our Strolling Thunder virtual voices will connect families from across the country and their babies to members of Congress. This is an event we usually do in person in DC in the spring, but had to sort of rethink in the new environment, so we'll be doing it virtually. But families will be sharing how the pandemic has impacted them and advocate for the investments that will support and stabilize the childcare system. Congress really needs to hear their stories and from you and from providers. There's many opportunities to participate throughout the month, including a day of action tomorrow, Thursday the 16th, being organized by the Child Care and Early Learning Coalition. And then 0 to 3 is also planning to leverage our Strolling Thunder visits with other advocacy efforts with a call-in day on July 28th, where we're joining with 20 partner organizations to flood the Senate with calls to think babies and act for childcare. So I encourage you to visit the website on this slide to learn more about these efforts and take action yourself. And then I'll just briefly share a few resources that we've developed to help states support their thinking around their child care responses. So all of these resources can be found at the website, the 0 to 3 COVID policy on the slide. But the first one there we just released this week, which offers some recommendations, things to think about related to mental health and relationships between childcare providers and parents that layer on top of the CDC guidelines to ensure that the developmental needs of very young children and families are part of state either reopening plans or continuing with their, if they had stayed open, their plans moving forward. The second document there we released earlier in the spring that really looked at supporting states if they were creating emergency child care systems, but I think many of the recommendations and considerations in there are relevant to, right now as well. They're not only if you're creating a separate system. And then the 5 critical needs for babies in COVID-19, this is sort of drawing from our broader recommendations, which cover our full policy agenda, to the specific things that we think are important for Congress to pay attention to within the child care and early learning context. And lastly then, for those of you that haven't seen it yet, our State of Babies Yearbook 2020 we released last month, and this is really a comprehensive resource that provides data on how infants, toddlers, and their families are doing, and it is there is national data, and it's also broken out by state. There are more than 60 indicators, and many of them, where it's possible to do so, are also disaggregated by race, ethnicity, income, and rural and urban settings. So I encourage you to take a look at that if you have not already. And now I'm going to hand things over to Jenna.
Thank you, Jamie. Thank you. Good afternoon, everyone. Appreciate the opportunity to be here and speak to everyone. To follow up on the national context and provide a little bit more detail about what's happening in the Commonwealth as it relates to our current situation, the support for recovery, focused, I think, primarily on childcare, but with the implications for preschool in our schools, as well as Head Start, talk about the balancing act around the guidance out there and how the trade-offs involved, talk a little bit more about some of the things we're doing on the ground here, kind of to sort of continue to support the movement, and then where we go from here. The first piece that I wanted to share is to kind of give you a sense of where we are as a state 4 months into the pandemic and across the early learning landscape. And I see from the attendance today, we have representative school divisions of Head Start, of private childcare, we're in centers or in our family day homes, and it continues to be an incredibly challenging circumstances. We are working closely with school divisions as they are working with their constituencies, their school boards, their stakeholders, their educators, and their families to figure out what reopening looks like this fall, in-person, virtual, a hybrid of those. We know how hard it is to provide adequate virtual learning to young children, right? One of the more challenging populations, particularly, are young children with special needs, and so trying to figure out how you do that. We know that some of our Head Starts have opened this summer after a period of closure this spring, although most are waiting to see how local school divisions are handling it. We have been tracking closely the openings and closings of childcare programs. As of today, or as of this week, we still have more than 2,000 programs across the state that are temporarily closed, and that represents a loss in capacity of 175,000 slots. We have switched from sort of tracking how many are closed to how many are open, and so right now we're about just under half of our larger centers are open and serving families, and our family day homes, which have just done a heroic job of staying open throughout the duration. 4 out of 5 of them are open and are serving our families, our subsidy families or non-subsidy families, kind of across our most vulnerable communities across the state. And we have done many of the things that Jamie talked about in terms of paying for enrollment, reducing subsidy, reducing copays for families, and trying to get direct cash assistance to programs. We know there have been challenges in getting those checks out the door, but we are working very closely, the Department of Social Services, Department of Education, and the Governor's Office to try. Our goal is to get all of that CARES Act funding, which Virginia received just over $70 million, to the field, out to the field by September 30th. So really kind of taking advantage and using those dollars. I want to sort of take a moment to pause, though, and hint at, or sort of to build on Jamie's comments about, recovery and be very real with where we're at. And I think this is, particularly as pronounced as we really think that the child care recovery is a function of both, who can open, who has the staff, who believes they can get enough kids in there, keep them safe and be able to function, and parental choice around feeling that their kids are safe to go there. We have remained open in Virginia throughout the duration. We did put in additional health and safety requirements in March, and then have provided some flexibility through the phase guidance. And as a result of that, if you look at this left-hand chart, you see that each month more and more centers are reopening. It's still in the hundreds, not in the thousands. And if you look at the difference month to month, it's 110, 150, but again, a fairly gradual reopening. And that's a slightly sharper curve than you see if you look to the right-hand chart in terms of the loss of capacity. So while we have more centers coming on, and that gives us some hope, we still, although we've improved from our worst point of just, a loss in capacity of over 200,000 slots, we're still, as of, mid-July, missing, in quotes, more than roughly about 175,000 slots across the system. And so still really tough out there. And as this goes on and on, there are real question marks about who will come back and who may not. I also think it's important to note that there's a desperate need for additional resources. So again, in Virginia, roughly the average cost of care is about $11,000, $12,000 a year. So you can think of a benchmark of $1,000 per month, right, per kid or per slot in average revenue. This means if you look back at those 5 months and the loss in slots, you're talking about, a potential total economic loss each month of $175 million, $210 million, right, $189 million. And again, in light of, Virginia received $70 million in the CARES Act, which was needed, but it doesn't even come close to covering the gap of potential economic loss that folks are experiencing. And then I saw in our attendees, we've got some providers who are open now, and even if they're not totally closed, they have under enrollment, right, because of the health and safety regulations or because of parental preference. They have higher costs of operating, supplies, cleaning, facial coverings, and so on. And so, the economic picture is really, really stark. And as we see schools choosing, for instance, to not come back, to go virtual, that can have a real chilling effect on families being willing to kind of put their kids back in care, which again makes it really hard to make ends meet and be able to kind of pay your teachers if you don't have that revenue coming in from your parents. So with that, noting kind of one, that the environment and the economic environment is incredibly challenging. I think the other point I wanted to note today is across our settings, whether in Head Start, in our school-based settings, or in our child care settings, whether in a home or center setting, they're facing real challenges on how to balance the guidance. And so the Virginia Department of Health, Social Services, and Education have been working closely to produce guidance, for phase 0, phase 1, phase 2, phase 3, to, where applicable, align it. Obviously, with child care, we have to take extra precautions because due to the young age of children, your infants and toddlers are very different from our 4 and 5-year-olds. And the guidance is online. I think, rather than go through that in detail, because the key challenge is really kind of acknowledging the trade-offs that everybody is dealing with. And so I present on this slide, some of the things that we know folks across the board are dealing with. The Department of Health and the public health experts are providing guidance, right? And the challenge that our providers are facing, the challenge that our school leaders are facing, is that all of it has to be kind of taken in consideration. So there are places where you can use physical distance. You can keep folks 6 feet apart, and that's the best strategy. There might be other scenarios, younger age kids, tighter classroom sort of space, less classroom space, where you have to take other approaches. And we're finding, as we've partnered with groups like E3 and VCF across the state, like it's really hard because there's not often kind of black and white sort of clear answers. It's very contextual, and each of these decisions involves trade-offs. And so how do you decide what the specific protocols are for your site, right? What does it mean? What does that mean for your staff, for your families, for your customers if you're private paying? What does it mean for your insurance and your liability? How you manage these new health and safety protocols? How do you implement them? How do you sort of support, folks to follow them day in, day out? One of the toughest things right now is how do you manage the smaller group sizes and meet the demand? And if that's in schools, figuring out, how can I get as many kids in as possible, but also keep kids, families, and educators safe. And then on the child care side, I know that we're getting a lot of pressure to kind of increase and go back to our typical ratios and group sizes because, more families are asking to return to care, and it's impossible with the iron triangle of childcare to make ends meet if you don't have full enrollment. I get an email in the morning at 9 that says, let us serve more kids, kids are safer. And then I'll get an email at 10 saying, it's unsafe to have kids in congregate care, we're putting lives at risk. And then, and so on and so forth throughout the day. And I know that all of our folks on the front line are getting similar messages. And then, I think the other key piece is now as we've got more cases across the Commonwealth, how do we handle those cases, right? How do we that becomes our new normal, right? Is that there's always going to be some transmission. How do we handle that? How do we continue to communicate with all groups? And how do you, at its core, keep bringing us back to, our purpose of supporting the learning and social emotional needs of all kids. And we do know that those places that have remained open have been lifesavers for the families, but also lifesavers for the kids. It's incredibly isolating for 3- and 4-year-olds to not be able to interact with their peers, with other loving adults. In those places that have been able to reopen safely, it had a huge positive impact on kids. This is just an example of one of those places, right, where there's guidance and there's not real clarity. I won't spend a ton of time going into this, but I think this is a place where it's recommended. We know that most places have come to a kind of a general practice of staff wearing masks, and yet we know that it's still incredibly tricky to figure out, do you have the kids wear the mask? And what we're finding is that different places, school division, Head Start, child care programs are taking different approaches, and so trying to balance on here's the guidance, here's what we know from the public health experts, but also making sure there's enough flexibility. I've had one center swear up and down, masks are good, they wear them all day, it makes the families and the kids and the staff feel safe, and then I'll have right down the street another center saying for us, we're really relying on distance and kind of other protocols, and we just can't do masks for kids. And again, I don't necessarily think there's a right or wrong answer there. It's all about balancing these really difficult trade-offs and really meeting the needs of your families and your kids and your staff. The other really important thing that has come up, and I want to make sure that folks are aware of, in addition to the guidance posted and the FAQs and the other resources that are on both the Department of Social Services and the Department of Education website, is that we've done a lot more work around contact tracing and really establishing a clear partnership. I think in the beginning of this, sort of how do we flatten the curve, minimize the cases. I think as we are striking a balance on how we can reopen safely and have more activity, right, more families returning to work, more kids involved in congregate care, our next real big challenge is getting to a place where we can manage, a flattened curve. And what that means, right, is that there's always going to be some cases, right? It's not a flat curve of 0, but you're just avoiding huge spikes in terms of, too many cases that your public health system can't handle. And so we've partnered and really are working with providers across the state. We want to make sure everybody on this call is clear and is letting their colleagues know that every center that's open, every school that's open should have an individual who's point of contact with the local Department of Health. We should be really building systems to kind of keep track of who's within 6 feet of a kid, staff person, and individuals for 15 minutes or more. That's that definition of a contact. And that, you know, as we see over the course of the next 6 months or up until the point that we have a vaccine, always being kind of, you know, prepared that if there's a case that, you know, the point person contacts your local Department of Health, contact tracing kicks in, and we are able to kind of quickly deploy, contact folks who may be affected, quarantine, and kind of keep moving forward, right? That we sort of we're able to keep cases as isolated cases and prevent outbreaks. And so that's been a really big focus in the last few weeks, and we're working with the Department of Health to make sure that all of our providers are aware of this, and also doing a better job of tracking cases that may come up in childcare and schools, and being able to delineate where were these one-off cases. For instance, an employee brought it to work, you know, from other settings, and where do we have outbreaks, and really kind of making sure that we are doing whatever we can do to limit the outbreak, so there's not kind of within center or within site or within school transmission. And then lastly, to wrap us up, just sort of where do we go from here? So as I said before, it's a pretty stark environment. Everybody's making really difficult choices right now. On the one hand, we have a real positive. More and more centers are reopening, and once they open, they're finding that they're able to increase their enrollment up until a point. And yet, on the other hand, we know that there's still hemorrhaging in terms of the economic impact. We are going to continue to support our programs that remain open. I think we're going to continue to monitor what's happening in other states. You know, we're still in phase 3, but, you know, that becomes increasingly precarious as you look at the national landscape, working with our community partners, our school divisions, our Smart Beginnings, our providers, the Child Care Association, to track recovery as it comes back online, and then doing whatever we can do to get resources out to the field, particularly to childcare, particularly to our family day homes, who are open and really serving as, you know, the last guard, the sort of last key resources for our families, particularly our essential personnel who need to work, and really kind of making sure that we're protecting them and supporting them throughout the entirety of this pandemic, which we expect will go on for quite a while. And then as we do see our bright spots, kids returning to classrooms, making sure that we're aligning the supports to kind of address the educators' needs, and most importantly, the kids' social emotional needs. I know that kids have been traumatized by this experience, and really thinking about how we come together, you know, double down and reinforce our efforts to not only provide every kid a quality experience, but one that addresses the hurt that they've experienced and puts them back on track to have every opportunity to enter kindergarten ready. So with that, that gives you a sense of the state landscape. I'll turn it over to Brian to talk a little bit more about some of your individual considerations as it comes to employment and liability.
Thank you, Jenna. And it's great to be here with everybody this afternoon. For this section, I thought it would be helpful to provide a quick high-level overview of what we're seeing from the employment side of the house with respect to common operational experiences that you may be experiencing or soon will be if you're not already back up and running. Having said all that, I know this is a lot to take in. You know, frankly, there's been a plethora of new laws and regulations that have been thrown at everyone from the employment side of the house. That's been a lot to take in. Likewise, with respect to old laws, we're certainly encountering all sorts of crazy new fact patterns and scenarios that no one ever anticipated in how they apply to existing regulations like the Americans with Disabilities Act, the Family and Medical Leave Act, OSHA, et cetera, is complex. And we know this. And so this sort of discussion is not meant to make you an expert, but it is designed to help you issue spot, at least from my perspective, what I see with respect to what are the 3 top challenges we're seeing in this space. And I think the first challenge we'll talk about is employee leave, what the new rules are, sort of, and things to look for. The second is employee screening. What can I do with respect to screening? What questions can I ask? What testing can I require or not require? And the third has to do with confidentiality and general liability. There are a lot of potential potholes that are out there that individuals need to be mindful of, and just having your heads up about that at a minimum so you can prepare, I think is super helpful. So let's talk about leave. And the biggest issue, and hopefully y'all have also participated on some of our other seminars about this, but the biggest issue in my mind is the Families First Coronavirus Response Act. If you haven't had a chance to participate in our other sort of more longer webinars about this, we have all sorts of online materials that are free access to our clients and friends, and you're welcome to sort of log into that, or I can send you links if you have questions. But what I'll try to do, at least in this section, is to give you sort of a very quick heads up about what it provides. And the reason we're focusing on this is it's new and it's complex, and it does apply to a lot of your sites. So here's the Family First Coronavirus Response Act, or FCRA, in a nutshell. First, the way to think about it conceptually is, even though it's one act, it's really, in my mind, two different acts because it has two different buckets of leave. There's a bucket of time that's technically called the Emergency Paid Sick Leave provisions of FCRA, and there's a second bucket of time that's the Emergency Paid Family Medical Leave under FCRA, and they're very different in how they work. Under the Emergency Paid Sick Leave side of FCRA, you get up to 80 hours, essentially 2 weeks, or the equivalent for part-time personnel, for use for certain qualifying triggers, all of which is paid. And there are 6 separate triggering events, which we'll talk about. Under the Emergency Paid Family Medical Leave provisions of FCRA, you get up to 12 weeks, which is a lot of time, of Emergency Paid Family Medical Leave to be used. The first 2 weeks of those, however, are unpaid. The remaining 10 weeks are paid, but it's designed to work in conjunction with Emergency Paid Sick Leave so that if you trigger the events, the first 2 weeks would be covered by sick leave, the second 10 weeks would be covered by Emergency Paid Family Leave. Rather complex. But there's only one triggering event. There are 6 triggering events for Emergency Paid Sick Leave, only one triggering event for Emergency Paid Family Leave. But it's designed to work in tandem. So what does FCRA provide? Well, it only covers individuals, and this is important. It only covers employers if you have fewer than 500 employees, the exact opposite of what most statutes run. Most statutes are designed to cover large employers, not smaller employers. Here, because of the tax issues in connection with this, it actually only covers smaller employers. There's an integrated employer test, which we can talk about if you have questions later for me, for legal entities and how they're combined. But for most sites that we're dealing with on this call, it's going to be sort of one legal entity that you're looking at. If you've got fewer than 500 employees, technically you're covered. FCRA pay amounts vary depending on the triggering event. It's not just whether you trigger leave, but how much you get depends on the type of leave that's being triggered for an individual employee. But you also have to keep in mind, and this is what makes these scenarios hard, separate from FCRA, separate from the new leave, doesn't mean that all the other leave laws that are out there go away. And so the regular rules regarding unpaid federal Family Medical Leave Act leave, or state and local FMLA and sick leave rules, and what you provide in your own policies about sick leave, PTO, et cetera, that hasn't changed. Now, you may revise some of that depending on the current scenario that we're in, but you got to keep in mind, FCRA is just an overlay to what already exists before. So what are the qualifying reasons? I'll hit the highlights, but again, there are 6. Number 1, you have to be unable to work or telework due to a need for leave because one of these events happened. And the key point here at a very high level is you've got to be able to not work because of the need for one of these events. If it's because of something else, i.e. the fact that you're just generally shut down because of economics, or because you're generally shut down because of the local stay-at-home order, FCRA does not apply. It has to be because there is work available, but the employee now can't work because they are, for example, subject to personal quarantine. And so that trigger up front is really key. So what about the other triggers? Well, item number 1, you're being quarantined. You've been ordered yourself to stay at home. Item number 2, you're self-quarantined. You haven't been necessarily diagnosed with COVID, but you've had direct contact and you've been ordered by a healthcare provider or otherwise to self-quarantine for 14 or more days, etc. Symptoms or diagnosis. You don't have COVID, you haven't been told to self-quarantine, but you've got symptoms and you're waiting a diagnosis. So you're in that sort of in-between slot. Item number 4, you don't have COVID, you're not self-quarantining, you're not waiting for a diagnosis yourself, but you're caring for somebody who's in one of those profiles. And there are, again, definitions that apply to all this about who's in and who's out. That's item number 4. Item number 5, child care. And this is a big one, obviously, for your population. If you need to be out because you have a child and your school or the place of child that you regularly use for that child is closed, or the child care provider is otherwise unavailable for reasons related to COVID. It can't just be because you've lost child care in general. It has to be closed or unavailable for reasons related to COVID. That's your personal child care that you use yourself as an employee. And then last but not least, substantially similar conditions. If someone is experiencing any other substantially similar condition as specified by the Secretary of Health and Human Services, fortunately, you don't have to worry about number 6 because HHS has not come out with what they think is substantially similar. So for right now, it's only really 1 through 5. That's the paid sick leave part. For family medical leave, emergency family medical leave, the thing you need to keep in mind is there's only one triggering event, and that's for child care. So again, when you get under paid sick leave, you get up to 80 hours. But for family leave, you can get up to potentially 12 weeks of paid leave. The first 2 weeks are paid by paid sick leave. The other 10 weeks are paid by emergency family leave, but it only applies to the child care trigger. It does not apply for any of the other triggers whatsoever. And a lot of people get confused about that because they think, oh, I've been out because I'm self-quarantining or because I'm waiting a diagnosis. I can stay out for up to 12 weeks, right? That's wrong. You can only stay out, at least under this provision, for a maximum of 80 hours. So what do you get on the pay? Well, there are caps, and I won't spend much time on this because you can look at the materials afterwards, but the amount of pay that employees get varies depending on the trigger. So for quarantine, self-quarantine, and symptoms of diagnosis, people get their full pay, but only up to $511 per day. $5,110 in the aggregate, so again, paid out over that 2-week period. For quarantine, self-quarantining an individual in a substantially similar condition, when you're caring for somebody, again, you only get 2/3 pay for that. You don't get full pay, and it's $200 per day, $2,000 in the aggregate. Child care is also 2/3 pay, but again, because child care is longer, in theory, but when you actually combine it together with paid sick leave, you can get up to, in theory, $200 per day, $12,000 $12,000 in the aggregate. So there's a lot of money involved, and you may ask yourself, how in the devil am I going to pay for this? Good question. Number 1, people need to keep in mind there's a tax credit offset, dollar for dollar with the IRS, that you're allowed to sort of utilize so that when you're paying what you would normally pay for your taxes, you get to sort of self-deduct all that up front as long as you keep sufficient paperwork. And there's good guidance online if you Google it from the IRS about how to do it. So in theory, even though the burden is on you to pay this as a new expense, you're supposed to be able to get a tax offset to cover this. So that's helpful. The other thing you may be saying is, even with that, I'm not sure I can do all this. It's just too administratively hard, too expensive, too complex. And some of you may have heard there's an exception that applies for some small businesses. And that's true under FCRA. If you have fewer than 50 employees, if you meet the test and you can show that the burdens of FCRA would, quote, jeopardize the viability of the business as a going concern, then you could either sort of opt out of FCRA as to particular employees or into your entire class of employees. And so you may be thinking, this is great. Why didn't you mention this first? Well, the problem with it is that exemption only applies to the FCRA reason for child care, the part that goes up to 12 weeks, both on the paid sick leave and the emergency family leave side. It does not apply at all to quarantine, self-quarantine, waiting a diagnosis, et cetera, for individuals. It also doesn't apply for care for individuals. It only applies to child care reasons under FCRA. And so even though it's out there, and you can look later at the test that we have in the slides, and I'm happy to talk to you about it, as a practical matter, is it really going to come to your rescue in the vast majority of potential circumstances that you're facing? No, probably not, but could it be helpful? Yeah, in some circumstances it could. You just need to think through whether you want to raise your hand and apply this particular exemption to you. Other things that come up a good bit, a lot of times people say, well, what about generalized fear? If I'm not being quarantined, I'm not being self-quarantined, I'm not caring for somebody else who falls into those categories, I'm not awaiting a diagnosis, I don't have child care issues. The employee just simply doesn't want to come back to work because they're scared about working in a COVID environment. Does that qualify for FCRA relief? And the short answer to that is no. The DOL has been very clear about that, and I think the regulations speak to this as well. Now, there may be other issues that apply, especially if somebody has a medical condition and they're claiming they can't come back because of that medical condition. You may have ADA issues. You may have straight up regular high-test family medical leave issues. But is it going to be a FCRA issue? No, it will not be a FCRA issue. A couple other things to think about, again, as you're prepping, and you've probably seen a good bit of this from the EEOC and the Department of Labor online, so I'm not going to spend too much time on it. But I'll just hit the highlights. On employee screening, we get these questions all the time. Am I allowed to do employee screening during COVID? Because normally that's prohibited under the ADA because it's a medical test and we're limited on what medical questions you can ask. Can I do it now? The short answer is yes. There's an exception for that. The EEOC has been very clear. It's okay to screen for temperatures daily, weekly, you name it. You can have employees check at home. You can screen people at the door. That's perfectly acceptable. It's okay to screen people every day, weekly, et cetera, about whether they've had a positive test, whether they have symptoms, whether individuals in their own household have had a positive test or symptoms, et cetera. It's perfectly advisable and perfectly okay. It's perfectly okay also to record this in some way. And frankly, it's a great idea from a liability standpoint to keep a record of this. What about testing? Can I require all of my staff to be COVID tested before they come back? Or can I require periodic COVID tests, even if people don't have symptoms? And the short answer is, again, yes. You can for the straight up viral test for COVID. But for reasons that I will not belabor too much here, the EEOC in their extreme lack of wisdom has decided that you're not allowed to do antibody tests, which, this is my little pontification, is ridiculous. But that's the rule so far. So you can do straight up more expensive COVID testing, but can you do antibody testing to sort of check on whether people have already been exposed? The short answer to that is no. So what else do you need to worry about in connection with all this? Well, there are ADA confidentiality rules that you need to keep in mind. None of that has gone away. Just when people test positive, the bottom line rule is, per EEOC, if you get a waiver and authorization from individuals, can you tell people that it was John who got positive and not just, quote, an employee who tested positive? Yes. Can you do it if they don't give you a waiver? No. The EEOC has taken the position that you're not allowed to use the employee's name. As a practical matter, does that create all sorts of issues for you if people don't authorize that disclosure? You bet. It's probably not acceptable for parents or others is to go back and say, oh, by the way, a random employee on Tuesday tested positive. People a lot of times want to know, well, who was it? Did I have contact with them? And so what I would tell you about that is you ought to develop a written authorization form. If you don't already have one, we're happy to help you with that. But likewise, you've got to be careful and pick your lawsuit. On one level, this is the EEOC rule. Frankly, it's a nonsensical rule in a pandemic, but it's the rule. But frankly, I'm more worried about the exposure issues and lack of contact tracing if you don't disclose certain basic information to individuals who have contacts. So you really have to think about that carefully. The other thing I'll just mention is there are all sorts of other liability issues you need to think about carefully and keep it attentive to. The biggest issue we're going to see a lot, frankly, is FCRA retaliation. And there are rules, just like the FMLA, about sort of, quote, interference with people's protected rights. And I think a lot of people will simply stumble in by accident to FCRA claims, and so you need to be attentive to that. ADA failure to accommodate issues. We're seeing this a lot where people just simply don't want to wear masks or refuse to, or claim they can't come back. We're seeing a huge spike in OSHA issues and Fair Labor Standards Act issues about pay. And frankly, you've got negligence issues that you need to think about. When you come back and you have your families return, you need to think carefully about what kind of releases and acknowledgments they're going to sign before they come back. The one legal trick I will tell you about this is be very careful about the language. Releases are great, and I've seen some good forms, and frankly, we've developed some good forms. But if in the release you put all sorts of representations about all sorts of safety things that you as a preschool or daycare center are going to do, and then you fail to do them, and the release is contingent in part on what you're doing, then is the release valid? Probably not. Probably not. And so you've got to be very careful about what kind of representations you make up front before people sign those releases in that document. Otherwise, it may not be worth the paper it's written on. So I know we threw a lot at you, and it's a lot of information separate from Jamie and Laura's good advice and counsel. If you need help from me or my firm about any of these issues, you have my contact information. Our firm also has, frankly, a great resource center for all sorts of COVID issues, probably more than you ever want to read during the summer, but it's there, and you're welcome to access that at any time. We encourage you to do so. So with that, I'll stop talking, and Laura, I'm going to turn it back over to you to see what we have from a Q&A. Laura?
Great. Thank you so much, Brian and Jamie and Jenna. That was a powerful presentation with great information, and as I said, we are going to be sending this PowerPoint out to everybody so that you can use it as a resource and let us know whatever follow-up is helpful. I also wanted to mention we've got the great resources for federal advocacy, but also wanted to mention if you're interested in joining our statewide advocacy efforts, it's virginiaearlyed.org. And you can go to that website and sign up for updates on what's going on at the state level. And maybe if we have time in closing, Jenna might talk a little bit about the special session. But we have two questions that have come in for Brian on the employment side. So I'm going to read those for the benefit of the audience. And then Brian would appreciate your help in responding to those. Christine Barber from Salem City Schools has asked, are school divisions that have over 500 employees still required to offer EPSL and expanded FMLA under FCRA?
Yeah, thank you. Hey, Christine. Thanks for the question. Just FYI, I actually grew up in Roanoke. My family still lives in Salem area, and I went to Northside, so I know exactly where you are. I know you're a good question. Mm-hmm. As far as whether schools divisions or any employer that have over 500 employees are still required and covered by FCRA, the hard thing about FCRA is there are different rules for public and private entities. And for the rule that I mentioned earlier, where you have to have less than 500 employees, applies to private entities. For public entities, you are sort of stuck with FCRA regardless of your size. And so even though it would be great to be exempt from that, as a practical matter, I'm afraid that's something you're going to have to struggle with. Great question.
We've got another question for you, Brian. It's coming from Michael Perry from Westmoreland County. He says he was on a superintendent's call this morning, and it was stated that the federal government has provided 14 days of leave with pay if an employee contracts COVID. I am only familiar with the currently discussed leave that was mentioned in this presentation. Is there another leave, Brian, that's being referred to, that's provided to employees in this situation?
Yeah, that's a great follow-up question as well. Thank you, Michael. I think that's a misinterpretation of what FCRA provides. If you think about the paid sick leave part of FCRA, which would qualify or be triggered if somebody actually develops COVID themselves, it gets you up to 80 hours of leave. 80 hours of leave for most people who are full-time is basically 2 weeks of leave. Now, most people think about that in terms of days, and so normally that's 5 days and 5 days. but sometimes people translate that as 14 days. But really, FCRA is really devoted in terms of hours. And so I think that's where some of the cross-translation comes when people try and describe what's available. Technically, it's 2 weeks, but it's 80 hours of time. And even if somebody works more than 80 hours in a given week, it's only 80 hours of time. But that's a great question.
Great, thank you. I've gotten another question, and I think I'm going to see if maybe Jenna can help with this, and Brian, maybe you can jump in at the end. How do programs manage the vacations of teachers, staff, and families as some are going to these hotspot areas? Is there anything that you can recommend?
So, Laura, I can answer from the non-legal perspective what we've heard from providers, and I think which is really important. Communication cannot be emphasized enough, and what has worked and why we think that some of our private providers have been able to really reduce the occurrence of outbreaks has been, open, consistent, transparent, and regular communication across the protocols, really taking seriously not only the temperature check, but identifying the symptoms that precede the temperature, and really working with staff and families to be responsible for, if you've been in a risky place, if you have an early stage symptom, take it seriously, and don't bring your kid in, don't come in. I think that's challenging from a legal, context, but that has been so important. What we found is what we did before COVID, right, which is, and I've heard it referred to as the purple pill, but like if your kid has a mild fever, you give them a kid's Tylenol, and you kind of, everybody does it, and we always have, illness every year in schools and child care centers, and that just does not work right now. And centers are reporting much more communication with families about this. Nobody I've heard is regulating staff or families on the off hours, but really trying to kind of create a sense that we're all in it together, and in order to keep everybody safe, like we need to not only follow these for compliance reasons, but we have to believe in these protocols, that these are the things that will keep our kids safe, our staff safe, and our families safe. And that's the sort of the non-legal practice that or best practice that we're hearing from the field.
That's helpful, Jenna. Brian, do you have anything kind of on the legal side?
Yeah, I'll just briefly mention two quick things. One challenge you need to think about is you need to go back and look at your policies that you have regarding PTO, vacation, sick time, and ask yourself, does this work in a pandemic environment anymore? Do we need to modify it in any way? And if so, what do we need to do? Just keep in mind that different states have different rules about when and how you can modify leave once it's accrued, so you probably need to chat with counsel about that. But we do have a lot of clients who are making small tweaks to their plans and policies to address a variety of operational issues. Two other things that are coming up a lot, is the flip side. What do you tell employees about what happens to them if they exhaust their time with you on the federal side and under just your regular policy? Most of the time, that's never an issue for most employees and for most employers, but it's going to become one, I think, during COVID. And you need to give some thought about what you tell people. A lot of people mistakenly think that they have this unlimited pool of time as long as they're out because, quote, they're sick or their family member's sick, and that's just not the case. And so I think, as we talked about earlier, just taking some time to educate employees coming back about what your rules and expectations are of what happens if they overuse time is super helpful. The other thing that we're seeing people tweak their policies to do is to require use of vacation time within certain buckets and certain periods. This is important because a lot of people have a lot of accrued time through the year. They haven't used it yet because they haven't been able to use it because they've been furloughed or they've been sitting out. And they come back a lot of times with huge buckets of time that otherwise might have gotten used for spring break and it didn't, or otherwise might have gotten used for summer break and it hasn't. And you can't simply have your entire workforce going out for the entire month of December. And so trying to think about how you're going to communicate that and what kind of procedures you're going to put in place to make people use leave is also, I think, something good to think about.
Well, thank you, Brian, for that. And I also want to thank our speakers, Jamie, Jenna, and Brian, for their efforts today. We've got a lot of good information that was shared. There were a couple of questions that came up towards the end, so we will be sure to respond to those in email. But again, thank you to all those that have participated in the webinar. We appreciate what you're doing, and we want to be a resource to you as you have questions going forward. So please reach out to your participants today and get any questions that you have answered, but we'll be following up with you. Thanks again for your time. Take care. Stay well. Bye-bye.